Breast conservation surgery is reserved for those tumors which are not metastatic and only combining confined part of the breast is being like you can do the lumpectomy, or you can do the quadrantectomy, or you can do the wide local excision, which is gaining popularity nowadays because most of the time for breast tissue is being conserved, and then there is less propensity for the implants like that. So the breast conservation surgery is mostly the wide local excision. Just you have to make a proper incorporate the tumor, give the excision, lift up the flaps, get rid of the excision, and then just you have to do the pick up the. Sometimes you have to do the wide local excision with the axillary clearance as well, because if the tumor is not locally very much infiltrative and you're sure about the margins. Now, margins is very much important. 1 to 2 millimeters in microscopic and 10 millimeter at least macroscopic margins has to be kept when you're doing the breast conservation surgery. And you can combine it with a chemo and a radiotherapy depending upon the extent of the tumor. Okay, so axillary nodal dissection is another important part because sometimes in which the axillary nodes are involved, you have to go for the axillary clearance. So this is a very good picture. You can see here the breast tissue is, there's entry to the axilla, and you can see that this is the axillary vein, and the cords of the brachial plexus and very, very important structures are located here. So you have to be very careful about the thoracodorsal pedicle, latissimus dorsi. Sometimes you can sacrifice the intercostal brachial nerve, but if you can preserve it easily, go for preservation. And then you have the level 1, level 2, and level 3. So the lymph nodes you can see here down here, these are the level 1 lymph nodes, which are located more lateral and below the pec minor muscle. Though located behind the pec minor, you have to lift up the pec minor muscle and go for the level 2 axillary dissection. And level 3 is more extensive dissection, and it's involving the part of the lymph nodes which are located more medial and above the pec minor muscle. So axillary nodal dissection is a critical part when you're performing. So depending upon the cancer and metastasis, you can perform the level 1, level 2, and level 3 dissection. Again, you can see here the pectoralis major muscle. This is the pectoral minus muscle, and this is the axillary vein, and these are the nodes which are along the pec minor muscle, and you have to do the clearance. So you can see the level 3, level 2 nodes, and level 1 below, behind, and above the pec minor muscle. So that's why pec minor muscle is very much important.